Good morning, everyone, and welcome to Statutory Resources Scrutiny Board meeting. I am Councillor Khan, and I will be chairing today's meeting. And this is the first meeting of the new 24-25 municipal year. As you know, this meeting is webcast live on Leeds Council YouTube channel, and I extend warm welcome to anybody tuning through this YouTube channel. Before I move to the agenda, I would like to put on record our thanks to the past members of the board who have now either stepped down from the public office or moved to other committees. Former Councillor Gora Mouse and Councillor Sharon Burke and Councillor Bithell and Councillor Firth, who are now on other scrutiny boards. I would like to welcome the new members for 2024-25. Councillor Graham and Councillor Hamilton, who both have been long-standing scrutiny board experience. Well, I mean, they've been experienced board members, and they are back on this scrutiny board as well. And I'd like to welcome Councillor Flynn, who was previously on this board and has come back as well on this board. And can I also welcome two other new members, Councillor Timms and Councillor Carlisle, as attending this first scrutiny board meeting, and welcome all, and I look forward to working with you all this year. And today we will be considering our terms of reference, cooperative members and source of work, a standard item considered in June meeting each year, along with other reports, one providing performance updates against the key performance indicators that sit in our remit, and others on the employee mental health and well-being, which this board had been keen interest in recent years. At this point, I would like to invite everyone to formally introduce themselves, and I also like to ask the guests to introduce themselves as well. So I will start from my left to introduce themselves.
Hello, I'm Andy Parnham. I'm Councillor for Armley.
Tom Hinchcliffe, Councillor for Bramley and Stanley.
Good morning, Councillor Sharon Hamilton, Moortown and Meanwood Ward.
Good morning, Eleanor Thompson, Councillor for Guiseley and Rawdon.
Good morning, Councillor Craig Timmins, Carvey and Farsley Ward.
Good morning, Councillor Karen Renshaw from Martin Robin Hood Ward, substituting today for Councillor Graham from Crossgates and Winmore. Thank you.
Good morning, Emma Camillo Price, Senior Intelligence and Policy Officer.
Good morning, Luke Andrews, an Intelligence and Policy Officer.
Good morning, Lisa Culver, Head of Health, Safety and Wellbeing.
Good morning, Richard Ellis, Deputy Chief Officer, Financial Services.
Good morning, everybody. John Mulcahy, Chief Officer, Elections and Regulatory.
Morning, Mariana Paxton, Director of Strategy and Resources.
Good morning, Councillor Simon Seary from the Pudsey Ward, substituting for Councillor Flynn.
Morning, Councillor Winkage, representing Morley South.
Good morning, Councillor Chapman, representing Rothwell Ward.
Morning, Councillor Ed Carlisle, representing Consett and Riverside Ward.
Morning, everyone. Rob Clayton, I'm the Principal Screening Advisor to the board.
Thank you for the introduction, and moving to the formal council business and moving on to the agenda. Agenda item number 1, Rob.
Yes, thank you, Chair. Yeah, agenda. These are just the procedural items, the first 5. Item 1, appeals against refusal of inspection of documents, of which there are none. Item 2 is exclusions of the press and public from the public domain, and there's no requirement for that today, Chair. Item 3 is late items, and there are no late items. And item 4 is declarations of interest. I'll just ask members to declare any now under Leeds City Council's Code of Conduct. I will take silence as none, and that's none, Chair. And then item 5 is apologies, already referred to by some members, but we have Councillor Simon Seary here for Councillor Billy Flynn, Councillor Renshaw is here for Councillor Pauline Graham, and we also have apologies, Chair, from Councillor Andrew Carter and Councillor Cooper as exec member. Thank you.
Thank you, Rob. So item number 6 is the minutes of the previous meeting held on the 25th of March 2024. Do members accept these minutes are a true record? Yeah, thank you. So what I'll do is I'll go page by page as well. Page 7, page 8, page 9, page 10, page 11, page 12, page 13, page 14, finally page 15. Thank you. Any members arising from the minutes? Nope. Rob, do you have any items to pick up, please?
Just very briefly, Chair, just to go through the minutes. So there were a couple of things that from the last meeting that I needed to pick up on. So minute 96, there was a view that procurement should be brought to back to the board this year. So that has been included in the draft work programme under item 9. Similarly, on IDS service desk, minute 97, that has also been included as per the past board's recommendations. And then minute 98, which was the EDI, Equality, Diversity, Inclusion statement, just to note that following approval at our March meeting, that is scheduled to go to Executive Board this summer. Thank you, Chair.
Thank you, Rob. Any other matters arising from the board members? No. Thank you. Okay, we will now move on to our agenda item 7, which is consider the COPSI members for 2024 to 25 municipal year. Rob, do you want to introduce this report, please?
Yes, thank you, Chair. Just fairly briefly on this one. All scrutiny boards are able to have co-opted members appointed to their membership. Some of them have legislative requirements for that, but the report does set out the options open to the board. So that's 5 non-voting co-opted members for a full year and up to 2 to feature as part of a particular inquiry. So that is an option for the board to consider should they wish to. I think in the past we haven't done, but that's just the way it's been. It's not to say we can't. So I think that introduces it, Chair. Thank you.
Thank you, Rob, for that report. Any comments or questions from the board members? Nope. Thank you. The recommendation are on page 17 of our agenda pack. Are we happy to approve? Yes, thank you. We can now move on to item 8, which is the report of the terms of reference for 2024 to 25, covering our remit and terms of reference that applies to all scrutiny boards. Rob, can you briefly introduce, please? And then I understand we have a presentation from Marianne and John to introduce to new board members and all of us to the service we have in our remit.
Thank you, Chair. Yes, so this is the board's terms of reference. Appendix 1 has the terms of reference that apply to all scrutiny boards. And then Appendix 2 is the Article 6, which contains the vision for scrutiny that governs all the scrutiny boards that we have at the council. And then lastly, Appendix 3 is the remits of the boards that sets out the services that feature under each board. And obviously ours is included in there. So that to some degree is the scope of our work focused on that remit. As the Chair alluded to, we do have a presentation from Mariana and John, which introduces this, and I can move on to that now, Chair, if there are no further questions.
Any questions or comments from the board? Nope. Can I ask Mariana and John to go through the presentation? Thank you.
Thank you. Thank you. Thanks, Chair. Yeah, I've got about 10 or 12 slides to go through, and John will come in at the end with the services that he runs as well that come under the remit of this scrutiny board. I'm going to go through them relatively quickly. It is a similar presentation to last year, so I apologise for those who were here last year, but we did get feedback that it was quite useful just to orientate the board for kind of, to inform the work programme and, kind of feed through into what the remainder of the discussions have. I'm going to be on my best Chris Whitty impression here. Do you mind going forward, Rob? Thanks. So yeah, we'll start off with, a bit of a, to be honest, you can read this in the press, the challenges and opportunities for the sector, but, I think it's quite important that we spend a bit of time on that. Strategic context for the whole organisation as a whole and the city as a whole. Then leading into the Strategy and Resources Directorate, because the functions from that directorate fall within this board. And then John will cover elections and regulatory services as well, which also cover within the remit. So, I think it's fair to say, we're kind of living in a pretty uncertain times at the minute, unpredictable, a lot of complexity out there that, we as an organisation and in particular you as members on your day-to-day, with your communities are dealing with a lot of this complexity and in terms of how it plays out. Lots of demographic changes been happening in the city recently. We'll be wanting to bring the Joint Strategic Needs Analysis update to this board, ideally later. Luke's working on that at the moment. Because that describes all our population and, changes that are happening with it, which obviously is a massive issue in terms of the services that we provide and how we work with people. I know COVID feels like a long time ago, but in lots of ways, I think probably there's still that recovery, particularly in terms of health inequalities. And obviously cost of living crisis has meant that, and you've read this in the financial reports, particularly that lots of our services are facing both increased demand, but also quite importantly, increased complexity of cases. And you'll see that, day to day through your surgeries as well. I think it's fairly obvious we are all doing kind of more with less resources. We're kind of well into austerity and we know that this had its impact. So what we're needing to do is kind of set and reshape according to the financial envelope that we've got. Since we did this presentation last year, there have been considerably more Section 114s issued across the sector. And I know, we'll have the finance reporting on this board at various stages throughout the year. So those things around productivity, not least because of the government's requirement around a productivity plan, efficiencies, digital, etc., and trying to kind of improve that customer experience for everybody remain key. We'll hear from Lisa later, and the previous board has done a lot on the kind of workforce challenges and the staff survey results, burnout, etc. And we also, have covered recruitment and retention challenges. And again, members will be well aware that that's an ongoing challenge for us. So collaborating with our partners remains absolutely crucial and right at the heart of that team leads thing that we talk about and that, again, members do on a day-to-day basis. The anchors network are maturing. We've got the main anchor network, the business anchor network, and there's the community anchor network. And, again, this board will receive reports on risk later on in the year. Fair to say that those kind of standing risks that are listed up there are still a constant feature for us. Thanks, Rob. I'm not going to dwell on this at all, but the previous board did receive a peer review report in the last couple of years. We had a first peer review in 2022 and then a follow-up in 2023 to check that we were progressing with the recommendations that are listed at the bottom of that slide. And it was very complimentary about the work that we're doing, although, none of us ever want to be complacent. We know there's a lot more to do, but it feels important for this board because that was about how the whole organisation and its partners operate. Thanks, Rob. So best city ambition, you know, we've got that kind of real big mission around, you know, reducing poverty and tackling inequality being right at the heart of what we do, and trying to do that through the 3 pillars that we talk about, with improving people's health and well-being, driving inclusive growth, and, you know, aiming towards zero carbon. We know that they are inextricably linked, those. There's lots of things that we try and do that are right on the sweet spot of across, you know, operate on the economy and health, for example. So they're really, really important. And this is something that is a city ambition rather than just for this organisation. If we want to tackle those things, we can't do it just as a single organisation. And crucially, and particularly what we've done this year with the Best City Ambition update, we've tried to articulate more clearly what Team Leeds means, because we're all doing it day in, day out. A lot of members are doing it all the time, but we don't always tend to make it explicit or clock what we are actually doing. And I'll unpack on a slide in a little bit, a bit more about what that is. Thanks, Rob. So as I say, that's was agreed, as you'll know, in full council earlier on this year. We didn't make fundamental changes, but there had been a revision to the health and wellbeing strategy and a revision to the inclusive growth strategy in the period. So we wanted to make sure that was, you know, they were very much relevant in terms of the current update, and also particularly to make sure that we embedded the MARM at work, which, you know, one of the sister boards to this board mainly focuses on, but that, you know, really trying to drive that kind of tackling inequalities, using that real strong evidence base and academic rigor as well as practice based. And we tried to be clearer about how we measure success, because we know that's a big issue for members, what our key partnerships are, and signposting to help people navigate through the complex range of strategies that we do have as an organisation, as this, because we are trying to achieve a lot for the people that live and work in the city. Again, I'm not going to read through this. I know Rob will have sent the slides out, but what we've tried to do with this kind of unpacking these 6 points is describe that Team Leeds, which I know on a day-to-day basis, lots of members, lots of colleagues, partners, etc. We do this. You know, you only have to look at what happened in COVID in terms of that good neighbour perspective, or how we try and empower people, you know, to make sure that they can do what they can to kind of support their own well-being, whilst at the same time also be supported by statutory and other services. Trying to be innovative, making sure we're kind of creative, that we bring those different solutions, and that social responsibility is the responsibility of every kind of organisation in the city, irrespective of, you know, what nature that organisation is. And then crucially there at the bottom, that being strength-based and asset-based, we try and retain our positivity and our optimism and seeing what people can do rather than what people can't do as being our default in terms of way of working. Thanks, Rob. So, but we do also have an organisational plan. So this is much more just for us as an organisation, but it's about how we then play our full role as you know, a convener and service provider, etc., within the context of the Best City Ambition. But it's crucially targeted at all those managers. We've talked here a lot in previous boards about the 2,200 managers that we have in the council, and how we want them to drive those values and behaviours so that everybody can be their best. And it has some clearly articulated manager expectations and describes some of the major changes that we want to deliver as an organisation, like, for example, core business transformation, which again, I think is on the draft forward plan for you to have a think about later on today. It incorporates the recommendations from the peer review, and importantly, this year's update, which we are just working on now and will hopefully come to the July board, will satisfy the requirements of the government for each local authority to have a productivity plan. So that will be where we will write our productivity plan. And then the reports in particular that Richard and Victoria and the team do each month on financial monitoring will be where we'll describe what we're doing with our productivity plan, because we're trying to not have it as an extra separate document that then, you know, causes more work for people and potentially confusing. Thanks, Rob. So that's the organisation as a whole. Delving now into Strategy and Resources Directorate, you know, we're a real mix in the Directorate of, you know, some high quality frontline services, often to the most vulnerable, particularly in something called Civic Enterprise Leeds. But for those who aren't familiar, you know, does everything from kind of transporting children to school crossing patrols and providing catering in schools and, you know, plumbing and etc. for mending houses. So a real mixed bag. At the same time, we provide organisational leadership on all the professional services, if you like, kind of the strategy, finance, you know, performance, digital, human resources. So all of that very much is within the purview of this board. There are about 5,000 staff working in Strategy and Resources Directorate, real mix of staff, you know, lots of low paid staff, which is, you know, and lots of digitally disconnected staff. So it's actually really good for me that the Directorate is a microcosm of the broader organisation in terms of those challenges that previous members of the previous board we've talked about in terms of that digital connectivity and how challenging that can be. And of course, we've got some key statutory functions discharged through, particularly through Victoria in her finance section 151 capacity, Catherine in terms of her monitoring officer role, the senior information risk officer is myself, and health and safety discharged through Lisa. So it just gives you some scale of the directorate. Thank you. Just delving down a little bit in that, again, I'm not going to go through this in detail, but that gives you a structure chart and the functions that are led by each of those colleagues. You'll get to see most of those colleagues at this board. You'll certainly see Catherine at full council. And, you know, we're all around and about and available for anything that anybody needs and, you know, provide any information. And it gives you a sense of what's in each of those service areas. And, you know, it's really important to see this, I think, for the forward plan, because it gives you a sense of what areas might you want to look at in the next municipal year. Thanks, Rob. So just bringing that to life a little bit, Civic Enterprise Leeds, I've already talked about. A real wide range of services delivered right the way across the city. You'll come into contact as local ward members with lots of colleagues delivering those services, do an amazing job, make a big difference, often unnoticed, I think, often kind of unsung really, but very significant. Integrated digital service, again, you know, matters to us all literally day to day and minute to minute, because if our device doesn't work, then we're kind of, you know, tend to feel like we've had our right hand chopped off, I think, these days. So really important from that very practical perspective, but also obviously strategically in terms of making sure that we're providing services day in and day out that, you know, on reliable platforms, and crucially as well, digital inclusion, which again, I know as members is really important in your communities. Legal, democratic and information governance, probably more obvious in terms of that is what it says on the tin. And again, you know, you'll come into contact with lots of colleagues there in the work that you do. Human resources, pretty wide ranging from the obvious, but also sometimes less obvious, perhaps things like workforce development, our EDI work in relating to the workforce is led within human resources. And then, as we know, we've got Lisa here today on health, safety and wellbeing. Financial services, again, probably people know the obvious things that are in financial services, but also, you know, there's lots in there on treasury management, internal audit, insurance, council tax and business rates. So again, big customer facing area within the work that Richard and Victoria do, and core business transformation. You know, we're heading to implement a new finance and HR system later on this year. So very, very significant project there. Strategy and performance is what I always call the eclectic mix of things that don't necessarily fit elsewhere, but, you know, are important, you know, in terms of what we do and how we do it, how we engage with the public, how we use our data, how we manage our risks. Business support, this used to have the contact centre in it, which, you know, I think people will be aware is moved to James is leading the work on the contact centre. But business administration, business support, that's actually about 700 colleagues. There's to sort out all our payroll, all the admin support to everything from social workers to car parking. So again, very wide ranging. And then lastly, but by no means least, relatively new appointment, just one person as our Freedom to Speak Up guardian. Vanessa has been to this board before, and there is a potential for, you know, her coming again later on in the year. That's learning from the NHS about how important it is that colleagues feel that they can speak up about issues that are adversely affecting either customers or staff. And has come out of some very, very, very high profile NHS cases, but we feel it's quite an important part of our organisational culture and the development of that. I think that's it. Hand over to John. Sorry to make you go through all that.
Okay, thank you, Chair. Thank you, members. Yeah, just one slide from me with the 5 service areas summarised on there that report through to this particular scrutiny board. So I'll start top left there with entertainment licensing. This service is led by Nicola Raper and looks after all the licensing of pubs, clubs, restaurants, bars, gambling establishments, and miscellaneous licensing such as scrap metal licensing as well. We also process temporary event notices, which a lot of you will get involved with for your own particular areas, and major events licenses such as Leeds Festival, etc. The service reports through to licensing committee, and all policy recommendations are made by licensing committee. However, this board has a role as part of the consultation process for major policies, and we do have a policy which will be coming through you very shortly, which is the review of the Licensing Act for the Gambling, licensing policy for the Gambling Act. So that will be coming to you shortly as part of the budget and policy framework for your input into that. Moving on then, at the bottom there is registrars, where we do, of course, register births, marriages, deaths, civil partnerships, and citizenship ceremonies. And that service is led by Steve Coop and is based in Merrion House, but the ceremonies that take place in this building here. In the middle, we have elections, which you will know are very busy at the moment preparing for the general election. We look after the register of electors and conduct all polls. We did come to the previous scrutiny board here to discuss the introduction of voter ID and the implications of voter ID when that became law a year or so ago. And we welcomed the scrutiny board's input and comments about that process, and they certainly helped us develop a very robust approach to it. As a result of everybody's work on that, the Leeds City Council was shown as an area of best practice for introduction of voter ID across the country. So we're very grateful for your help and input into that, those members that were part of that on the previous board. Elections is headed up by Susanna Benton and is based in the Civic Hall here. Moving across then, we have taxi and private hire licensing. Again, this reports through to licensing committee for policy decisions. Licensing decisions are taken by officers, apart from in one area where we're trialling at the moment for minor motoring convictions, where any driver that's considered their licence for revocation for totting up of minor motoring convictions will come before a licensing subcommittee. Since we introduced that policy 2 years ago, there's actually been no need to refer any drivers to a licensing subcommittee. So that policy is working very well. And we do have a review coming as part of our forthcoming policy reviews, where we'll be considering whether members should take on any other licensing decision roles for taxi and private hire as well on the back of that pilot programme. The sort of licenses that taxi and private hire look after, of course, are all the related private hire licenses and all the hackney carriage licenses as well, which are all listed on that slide there for your information. And finally, at the bottom there, we have land and property search services, which is an amalgamation of the old local land charges. Sorry, I should have said taxi and private hire licensing is led by Jason Singh. Apologies, I didn't mention that at the time. Moving on to land and property search services, which is led by Gareth Moore. That's an amalgamation of local land charges and the street registration functions. Local land charges, as you'll be well familiar with, is the service that deals with all property inquiries regarding new transactions, purchasing of houses, etc., where we provide search information on whether the roads are adopted, whether there's a combined public sewer that's looked after by the authority outside, whether there's any planning permission history on the house, etc., that allows solicitors and prospective homeowners to make informed decisions on their purchases. And street registration is exactly what it says on the tin. When we put a new street in and it is named, it's registered on the database nationally, so it can be picked up by everybody, including the sat-nav people that do your route planning when you press the button in your cars to get from A to B. So that's an overview of the 5 services that report through to this scrutiny board. I do have 2 other services. That's all of the environmental health services and parking services, but they report through to the Communities Housing and Environment Scrutiny Board, not this one. And that's it from me. Thank you, members.
Thank you, Mariana, and thank you, John, for a very informational presentation as well. And I hope the presentation has helped, to refresh the previous members and also, for new members as well, for what the remit within our, statutory resources scrutiny board is. And I will open for any questions or comments to John or Mariana. Oh, well, you've done really well there then, haven't you? Well done. Thank you. Are we happy with the report recommendation on page 21? Yep. Thank you. We now move on to agenda item 9, which is the source of work item. And an item looks at our draft work programme. Just to note that this is very much a draft and open to comments and discussions from board members, senior officers and exec members under this item today. Rob, do you want to just introduce the spot, please?
Yes, thank you, Chair. Yes, so this introduces the draft work programme for the 24-25 municipal year. On that, there are recommendations from the past board and then standard items that we tend to take at scrutiny, which would include things like the budget consideration for the forthcoming financial year. The report does emphasise pre-decision scrutiny and adding value as 2 main features of it, in order to maximise the potential of scrutiny and try and deliver as many outcomes as we can through scrutiny statements like the EDI one that we did last year. So that is emphasised in the paper. But other than that, Chair, this is really an opportunity for members to try to shape the work programme. There are spaces in the work programme that's attached to Appendix 2, so it's an opportunity for members, should they have any ideas, to try to feed them in. And obviously, I would take that away and, in conjunction with Councillor Khan, agree an additional draft work programme that I'd bring back in for July. Thank you, Chair.
Thank you. Before I bring the board members in, Mariana, do you want to, comment on this item as well, or shall I just wait till the end of the comment discussions?
I'm happy to wait, Councillor Khan, and hopefully the presentation's helped, and then very happy to kind of answer any questions, make any other suggestions. But I think we've put a fair bit of work in already to what might work for the board. Thanks.
Thank you. Board members, any suggestions or comments on this item? Councillor Hamilton?
Just where it says we got working with external partners, it's got a University of Leeds. Is it just the University of Leeds, or for significant expertise? If any of the
Rob, do you want to pick this up?
Yes, thanks, Councillor Hamilton. Yeah, so that's some initial links that myself and my colleagues have made with the University of Leeds. So that's why I've referenced them. But actually, you're quite right, though. We could go beyond that, and It is at an initial stage, so I will stress that, but we have that idea has come up of more than just the University of Leeds. So where we have an in-depth piece of work, we would use those connections that we're just developing now to try to get that external voice in where it's appropriate. So that's what that's about. But you're right, it could go beyond them. Yeah.
Thank you, Rob. Anybody else? No? Rob, looking at our remit and given the number of staff that work in the service, should we consider an item on the civic enterprise leads? It might also link into the procurement, but an update might be helpful for the board.
Yes, Chair. Yeah, I can put that in there, very much within our remit. Yep. So an update item, we have considered that. We going back a few years though. So yes, it's probably it's been a while since they've been. So it might be a very good idea. Thank you, Chair.
And can I suggest also, would an item on the core business transformation also be useful as we move towards implementing?
Yeah, Marianne will probably know more than me on this, but yes, again within remit, and certainly as I think was mentioned in the presentation, it's potentially something. Yeah, absolutely. I'll take a note of that.
Marianne.
Just want to think about timing with core business transformation. It's heading to exec board for an update in September. So whether we can quite get before that or whether July is already quite full, but certainly it's a good one to get into. It's key time for us.
Thank you. The recommendation on page 39. Oh, God, sorry.
It's just looking, thank you, Chair. I'm just looking at on page 50 where it says child-friendly Leeds 12 wishes. I'm wondering how they ensure that they engage with all children and young people to hear voices of all, because is it just a selective few young lives that they actually get the opinions of, and how do they make sure that it covers the breadth of the different cultures, etc., and people within communities that we all have to deal with?
Yeah, Marianne.
Yeah, whether that's one for this board, Councillor Renshaw, or whether it's a children and young people board. I mean, obviously consultation more broadly is within the remit of this board. So it might be something Rob and I can take away, look at when it's been looked at and either drop a note with some reassurances of how it's been done or maybe inform the future work programme. Yeah.
Thank you, Marianne. Rob, do you want to update as well?
Yeah, thanks, Chair. Yeah, Councillor Renshaw's on Children and Families Board, and I'm the advisor to it. So you may recall, Councillor Renshaw, that I am working on that through that board. So with the Voice and Influence team, trying to get the voices of children and young people heard through that board. So that is something that I am picking up through that route.
Thank you, Councillor Renshaw. Is that okay? Thank you. The recommendation on page 39. If we are happy with these with this item, I will move on to item number 10. Yep. Thank you. So we now move to agenda item 10 on performance against the 18 key performance indicator KPIs that we'll have in our remit. Emma, and are you introducing the report?
Yes, I am. Thank you, Chair. So good morning, everyone. This performance report contains details of a number of organisational plan key performance indicators divided across 5 service areas, and it's providing data for Q4 of 23-24. We bring a report twice yearly to this board, so in January we also come and bring Q2 data. There are a number of off-log indicators as well included within the financial services section. I'll touch on those in a moment, but I just wanted to pull out a few key points from the performance report before opening up to any questions. So the first one I would like to mention is within the human resources section, and that's healthy workforce at point 3. This shows a small increase in sickness amongst LCC staff from the Q3 figure. And the report also highlights that across directorates, long-term sickness accounts for between 65 and 75% of all time lost through sickness. I'd like to mention at point 5, the gender pay gap. The snapshot taken on 31st of March 2023 revealed a further drop in the gender pay gap down to 3.4% now. Customer relations at point 15. Members will note that complaints performance in some directorates does remain below target. We have an 85% target, and for the Q4 period, January to March 2024, we are showing 78%, which is an improvement on the same time last year, although just fractionally below the Q3 figure we previously reported of 79%. And on information management and governance, and that's at point 16, performance continues to improve. The target is met in both streams there. The next goal for the service is to improve even further on that and meet the standard that the Information Commissioner's Office regards as good, and that would be above 95%. Our figure for Q4, I should mention there, is 93.49%, so not too far off that target at the moment. I mentioned Offlog, and for any members not aware, Offlog was launched in July 2023. It aims to provide accessible data and analysis about local government performance and to support improvement as well. A number of metrics have been introduced initially for 4 service areas. Further have been introduced, and I understand that there's more work taking place to introduce more metrics over this year. So we are incorporating those into our regular corporate performance reporting to Scrutiny, to CLT and to Executive Board as well. And that's everything I wanted to mention. Thank you. Thank you, Chair.
Thank you. Any comments or questions from the board? Councillor.
Thank you. Yeah, I've got a few questions actually, or comments as well. First one being in general across this, it would be useful, I think, if we could see the year-on-year changes over a period of years. Quarter on quarter is easily affected. In some case, obviously, something like representative workforce isn't going to change very quickly anyway, but some things can be skewed. And I've been back through previous papers and pulled out some of the data, and actually things have not changed very much. So I think it would be useful to explore that a little bit more. And that leads into where you've done the analysis by directorate, which we did ask for last time. So thank you for picking up on that. It's interesting to look at. It would also be interesting to see if this is a normal position, or if it's getting worse in some directorates rather than others. I mean, clearly how communities, housing and environment stand out. So that's more of a comment, I suppose. Moving on to long-term, short-term sickness. What actually is long-term absence in our definition of it in the council? And is it possible to break it out into time bands? So how many people are we off in the long-term section particularly? How many people are, say, off for 15 days or 30 days or more than 6 months? We've no idea really on what the seriousness of our problem is, I suppose. And then another general one is about the comparison with other core cities and neighbours cities, which we've done in the past on, I think, on the gender pay gap, but I think it would be interesting to do it on some of the other, say, the sickness absence and the sickness reasons. If we can do that, if we've got it or we can get it, I think it'd be helpful. And then just one other one on musculoskeletal. That's actually getting worse over time as a percentage of the total. And we have raised this before and asked about what sort of training the staff giving. I can see some of the networks are setting up, they've got physiotherapy sessions or physio sessions to help them with the symptoms, but how do we stop them getting those symptoms in the first place? Sorry, that's quite a lot, but thank you.
Thank you, Councillor Chapman. Emma, do you want to come back?
Thank you, Councillor. Thank you, Chair. Yeah, I'll try and take those points one by one. So in terms of the year-on-year change, yes, you're quite right. We do just tend to show the one comparator in this report, and we try to pick where that's most sensible, whether it's comparative to last time or the previous year. But indeed, I can look into providing some brief basic historical data, because as you say, some of these will not change drastically quarter on quarter or even year on year. So I can look into providing that for the next report. In terms of a few of the other points you mentioned, I think I can perhaps take together analysis by directorate and the change over time by directorate, and a couple of these other points in terms of providing more information around sickness breakdown, core cities comparisons. Certainly I would have to check with the service to see what sort of data they can regularly provide, but maybe that will be a conversation to see whether that's something we just include perhaps as a one-off, all that additional information next time. It may be that it's perhaps not practical to include that level every time, but obviously happy to be steered by the board on that one. And in terms of, again, the final point, I think in terms of musculoskeletal figures and looking at preventative work, again, that's something I can particularly highlight to speak to the service about next time we do the report, so we can provide some appropriate narrative around that. I think that covered the main points. Thank you, Councillor.
Thank you. Councillor Chapman, do you want to come back?
Yeah, thank you for that. And sorry, I found another question. Do you mind? It was on the complaints. I was going to ask if someone could explain what the process is to get from them being received to going to stage 1, because only 81% go to stage 1, as far as I can see, and then they progress to stage 2, I presume, if they're not resolved. So do they get some get resolved before they go as far as stage 1? And then the other question was, this is just for council, so I'm particularly looking at housing within community housing and environment, but this is just council house tenants and not the housing association tenants, is it? And if it's not housing association tenants, do we do anything to track what's going on with housing associations? Because they are taking on quite a lot. We contract with them to do quite a lot of the housing, but I'm struggling to find any statistics anywhere on how they are performing. So if we're contracting with them, I'd expect us to have some sort of performance measures with them as well. It might be outside the remit of the board, but I'm going to ask anyway.
Thank you, Councillor Chapman. I'm going to bring Mariana, then I'll bring Emma, if that's okay. Yeah.
Thanks, Chair. Councillor Chapman, I mean, they're obviously all really good questions. I think what we might need to do when we've got that level of questioning is almost come back as a more specific item to be able to do it justice. It's probably, I mean, Emma can do her best, and we can try and refine the report each time we come with a bit of extra information. But I think to do justice to it is the kind of thing that we might want to have a bit more of a deep dive into. I think on complaints, my understanding is that they would have, the reason they wouldn't be on there is because they've been resolved prior to, you know, there's been that conversation to work through a misunderstanding or something of that nature. I'm not aware that we do collect any housing association information through our performance information, but we maybe do through contract management. But that would probably be more a remit for community housing and environment, I think. And if we need anything extra on musculoskeletal, then we've got Lisa, who can probably answer in the room to save Emma a job of asking the service, if that's helpful. Thanks, Chair.
Okay. Lisa, do you want to come in?
Thank you, Mariana. Thank you, Chair. Just a very quick corporate perspective on the musculoskeletal. That sits within our ergonomic work stream. It is a high priority for us. The HR business partnering team, the health, safety, wellbeing business partnering team and occupational health are working together, looking at this data so that we can make more data-informed choices to target these areas. I am aware that next year there will be musculoskeletal and manual handling toolkit, which we will be launching within those priority services, which always comes with free training for all our colleagues. So please bear with us. That is on our radar, and it's something we are working hard to sort.
Councillor Hamilton.
Thank you, Chair. Mine was regarding on the complaints regarding the SenseUp workforce. You know, it doesn't tell us exactly the numbers. You know, it says that 3 agency resolution officer, and they finish within quarter three. And the complaints continue. How many complaints have there been and how are they addressed? You know, with regards to the numbers. And I noticed down here, it says that within children, families, a notable number of complaints arise from the delay. So how many of those? And then it goes on to say, a number of complaints arise from delay relating to assessment by an educational psychologist. You know, it's not saying much to me really, is it? It's just saying it's that person's fault why we got all these complaints. What are we doing to address it? You know, with regards parents waiting for these information, their complaints to be addressed. A limited resource from within the EP services now addressing these complaints. How are we getting on with them? Are the complaints being addressed, the parents, you know, because these are children that we have, you know, and to me, that doesn't read well. You know, it doesn't read well. We get lots of complaints from parents who are unhappy. So yes, I know I can understand we have short staffing shortage, etc. But while staffing shortage, how fast are we acting up on these? So that's my question to that. I'm not happy with this paragraph, how it's written.
Emma, do you want to pick up on Mariana?
Thank you, Chair. I'll just briefly say that it's certainly something I'll take back for the next report, that I can put a note down that we can get some, if available, I can get some more of the specifics where specific figures can be quoted and expand the narrative to have some more specifics on work that's been done and being planned. But yeah, I would have to speak to the service about that. Thank you, Chair.
Want us to say that and then we don't get the information.
So Hamilton, if you be a bit patient, I've got other officers and they will be able to respond to your question as well with some update. Okay. Okay, just be patient. Yeah, just be patient and you know, you'll get the answer. If you're not happy, then you can always come back as well. Thank you. Rob, do you want to
Just briefly, Chair, yes, so as I know, Children and Families, I'm the advisor there, so this has come up as an issue at Children and Families Scrutiny Board. We've done an inquiry on it, so but I mean the figures there reflect the problems that Scrutiny identified actually, and my understanding is there's a report going to Exec Board on it. There's an EHCP Send Services Review report which tries to tackle, that's going this week. So it will try to tackle the issues raised. Education psychologists, I think nationally there's a shortage of them actually. It doesn't deflect from the point you make though. It's a valid point, but I think that's a national issue. And then there's a 20-week timescale, which I think to access an EHCP, which I think much of that is related to the demand increases and pressure on the service has been such that they simply can't meet that timescale at the moment. But there is work ongoing to try to address it. That's just from my other board's work. Thank you, Chair.
Thank you. Councillor Hamilton, do you want to come back again?
We're going to address you, Chair, but I will hold my peace. I won't say.
Thank you, Councillor Hamilton. Anybody else got any question on this item? Councillor Thompson?
Thank you, Chair. So specifically on the long-term sickness, do we have any indication, I appreciate it's not easy to measure, about the impact of long waiting times for treatments and what impact that is having on workforce absence?
I'm looking at Lisa because I'm certainly not aware that we've got anything that specific. I don't know that we always even have that information in terms of the cause and effect. Again, it's something we can try and take away and have more in our psyche and try and kind of explore more, you know, within the capacity that we've got available to do it. But I'm not aware of anything, I'm afraid, Councillor Thompson.
Lisa?
Yes, just to say, I will double check that. I'll take that as an action and see if we've got that data.
Anybody else? Nope. I've got a question on the KPI 1. The number of staff with disabilities lags behind the city wider data and not have improved recently. What are we trying to do to improve this?
I mean, I think, as you know, it is a challenge. What some of the big things that we've done most recently, as you'll recall from the conversation we had in February with the staff network chairs, you know, was particularly about trying to adapt our recruitment approaches, so that we try and remove barriers for colleagues who either have a visible or an invisible disability, so that we try and make sure that we do get more colleagues in, and that once those colleagues are in, they can progress more. I think the other thing is trying to make sure that we support those colleagues well through the disability staff network that we have. That again, you know, we heard from them in February, to make sure that people feel valued as a disabled colleague, and to make sure then that that gives a good kind of record, if you like, a good recommendation for other colleagues to join. Try and make sure that where we have people need reasonable adjustments, we're able to give those reasonable adjustments, so that we have a good reputation as being, you know, a good employer for colleagues who are disabled. They're some of the main things. Again, unless Lisa can add anything extra.
And I've got another one on the opportunities to develop KPI 6 on staff progression. What more can we do here to provide opportunities for staff to progress?
Again, I can pick that one up, Chair. As you know, two of the big things that we're doing around that at the moment, one is that very sort of universal offer for all managers around our Be Your Best programme, which is a leadership and management development programme for colleagues that will enable people to kind of, you know, make sure that we are supporting them with training, mentoring, coaching, shadowing opportunities. And we just had a kind of another push on that last week actually, with an all manager colleague call with Tom explaining what's on offer. Ideally for that to then be picked up through appraisals. We're in the appraisal season at the moment, and an important part of people's appraisal is, what about your development? What are your ambitions? How can we support you with those ambitions? And then the second big thing that we're doing around progression, but this will only benefit a small number of people in year one, is the Aspiring Leaders programme, which, you know, John Ebo talked about in the previous board, where we've got those 16 or 17 colleagues. Luke's an example of an aspiring leader, colleagues who've put themselves forward to try and have more progression opportunities, have more support provided to them. They've been doing, you know, quite rigorous personal development planning, you know, with an eye to them when there are opportunities for promotion and progression, that those colleagues are really ready to be able to take those opportunities. But this is one again that is, you know, it's slow progress rather than a, you know, a rapid development opportunity.
Councillor Renshaw.
Thank you, Chair. I'd just like to ask on that, Mariana, you mentioned managers, but sometimes the staff working below the managers are actually more experienced and have got more knowledge about the job that is required. So what opportunities are being given to those lower level staff who are working on the ground and getting the jobs done, if the managers are given opportunities to do further training? Are they being given the same opportunities?
I mean, anybody was able to apply for the Aspiring Leaders programme. There wasn't a grade boundary or a manager or supervisory role requirement. So that was an opportunity for anybody. So that was very definitely open to anybody. The programme I've talked about specifically is targeted at managers, because that's a big part of, you know, us being an effective organisation. But there are lots of training opportunities that are available more broadly for colleagues as well. And ideally that is in the conversation around people's appraisal, so that, you know, if you're having an appraisal and you feel you can do more, then you get that opportunity on the back of your appraisal. But, you know, and we do have good completion rates around appraisals, and increasingly the quality is better. But we do also know that it's not perfect everywhere. So that's another reason why the investment in managers is important, to be able to support staff to be their best.
Thank you, Mariana. Is that okay, Councillor Show? Yeah.
I could come back on that, Chair, but I'll leave it for now.
Next out on the list is Councillor Thompson, please.
Thank you, Chair. Sorry, I'd noted this down and forgot to ask it previously. In terms of supporting local businesses, so item number 17 on here, do we have any picture of the longer term trends on that? Because as it says, the contracts tend to be longer term, but do we have a picture of, say, the 5-year trends or anything else on that so we can see how we're progressing? Because when it's difficult to measure quarter by quarter, and then how that impacts on the social value and things like the Leeds food strategy as well. Thank you.
I don't have that to hand, Councillor Thompson, but certainly, and we had procurement a couple of sessions ago, didn't we? At the very latest, we can bring that through when we talk about procurement again, but we can try and get a note just if there is any intelligence on that in the meantime as well.
Yeah, just to follow on from Councillor Thompson supporting local businesses, KPI 17, it's good to see the improvement performance from the information governance, big improvement and possible something we could look at in more details later this year. Yeah. Anybody got any comments or questions on this item before we move on? Well, thank you, everyone. And are we happy to move on the recommendation on page 63? Yeah, thank you. Our last item today is agenda item number 11, which is the update report on employee mental health and well-being. We look at this in 2023, and this provides an update position on the board. It goes without saying that happy and sport workplace force is also a productive workforce. We have presentation to support this item. Lisa, do you want to run through the presentation, please?
Thank you, Chair. It's a pleasure to be with you here today. The last time I was here sharing our health, safety, well-being system and our mental health and well-being approach with you was in October. We had some really rich conversation. So thank you for that. It's really given us a steer over the past few months of the direction of travel. This update today really is a continuation of the proactive approach and focused priority we place around colleague mental health and well-being here at the Council. Today, I'm going to be covering 3 areas. The first one is a progress update on our integration of our health, safety and well-being framework and approach. The second one is to share some real examples of good practice that we're seeing within our services. And the third one is some progress updates against some key actions led by the corporate health, safety, well-being team. It's important to share with you that we, like many organisations, continue to reflect on colleague mental health and well-being in the wake of the pandemic. Our data mirrors that of the national picture, and our staff survey results show us that colleagues do feel supported at work, however, do feel pressured and their workloads could be more manageable. Here at Leeds, health, safety and well-being is very much a good news story. We're doing an inordinate amount of work within this space, and it remains a top priority for us. We continue to look not only inwards with honesty and drive and passion to improve, but we also look upwards and outwards at others to search for best practice and inspiration. We continue to be a people-focused organisation, and we lead definitely with compassion. The work I share with you today is underpinned by our very strong and clear values and behaviours, our people strategy, which includes Be Well, clear manager expectations, and our holistic wellbeing programmes, all of which helps us deliver our best city ambitions and create a psychologically safe culture for colleagues to speak up, to reach out, and to be their best selves with confidence. So the first slide, thank you, Rob, for sharing, we're going to be touching on today is bringing our vision and our approach to life, which in October I explained and took you through step by step the devolved model. We appreciate that we are a large and complex organisation, and so we need to empower our managers to be confident and competent to make the right choices and support our colleagues appropriately. So the first update is about that integrated vision for health, safety and well-being. And I'm really pleased to update you that that has been embraced. We have such engagement and buy-in because that system works for us. It's lovely to see well-being sitting on that platform because it enables it to have absolute focus. 2024-25 for us is all about getting really strong foundations in place to drive sustainable improvement within all these three areas. And this includes safety compliance, supporting occupational health, and improving colleague well-being. The second element we were really passionate about getting right was a strong director engagement with personal pledges. This has happened and it is yielding positive communication outputs. Each of our 5 directors have chosen wellbeing and mental health as one of their annual priorities, and this is underpinned by an action plan. The approach increases accountability, ownership, and realistic expectations within our services. In turn, this helps our colleagues see, feel, and hear visible change. Our directors continue to have one-to-one check-ins with myself, and these are going very well, and they help us to work together at a strategic level, enabling a tailored, preventative and evidence-led approach, again, pulling in that data that we've just been talking about. The third area is business partnering. We have a wealth of knowledge and experience within the business partnering team, and joined up with HR, occupational health and health, safety and wellbeing business partners, our chief officers continue to be supported, engaged with, and start to negotiate and work through those challenging compliance issues so that we can really underpin it with our promote, prevent and support strategy. This expert support is further enhanced in service by the implementation of an additional 10 in-service health, safety, wellbeing officers. These support individual managers across all 23 of our services. Services, in particular frontline colleagues, continue to be supported with mental health first aiders and wellbeing champions. And I'll touch upon those again in a second because it's a really important community for us. Both of which are under review. And again, I will touch on it because we want to maximise the impact of our mental health first aiders who are incredibly capable and passionate, but I want them to be something that is before crisis. They've got so much to give and I want to support them to enable to deliver that. And the final area of update on this slide is the corporate team. We appreciate, as I mentioned earlier, we are large and we are complex, and to achieve these successful outcomes, we must support our managers to be confident and competent to manage risks and support colleagues. We do this by setting a strong direction, providing support and guidance and training and really practical toolkits for them to embed within their areas. Thank you, Rob. The second slide, we look at some really examples of really good practice within our services. We've been listening to services over the past 12 months to better understand how we can help them within their wellbeing space. They've been asking us to be more explicit in what they can do to embed our 3 wellbeing pillars: prevent, promote and support, and provide a strong wellbeing management system. As a result of this feedback, we have created a service level wellbeing standard, which is a good benchmark. This is the nuts and bolts of what good wellbeing looks like from a practical perspective. All services will begin to implement this standard later this year and will check in with them annually as part of their health, safety and wellbeing audit to measure success, set future goals and those next steps that are so important as we navigate through the change. This will better organise our services, support those who are less mature and need that extra help, but also help the arrangements become more proactive in those that are already doing really good work. So in the meantime, whilst we're working on that, we do have some really good examples of best practice. And these are care delivery service who are creating support circles and a men working in care support group. Waste management have created drop-in opportunities for staff to speak to a whole range of specialists in housing, debt management, physical health, mental health and gambling. And again, that's really important because when we look at the well-being wheel, we've got how are you, what's your community, financial well-being, psychological well-being, physical well-being. They are all key elements that we need to be supporting and raising awareness. Leeds Building Service have 2 mental health support groups that are really, really popular, and I continuously hear them being spoken about by colleagues all the time. Simon's Space for male workers and Be Kind to Yourself for female workers. Children's nursery staff have created a mental health newsletter, and they're doing lots of promotion around our mental health first aiders. Again, that really key community for us. And City Development have face-to-face sessions for 120 of their depot staff on a whole range of topics, again, weaving in that well-being wheel, including neurodiversity, a hot topic and it's getting hotter, stress and mental health support. And they've just launched a Manbassador program as well. When I was last here, we spoke about the combined conversation around well-being and mental health, and we felt that it would be better to just take them as separate so that they had an absolute focus. And that's what I've done on these last 2 slides. So the first one is to just give you an update on the well-being work. The first thing for us was leadership accountability. We're really, really seeing this. The conversation is rich, the actions are proactive. We're seeing investment in building strong foundations, getting buy-in and seeing real green shoots out within the service. We wanted to start looking at toolkits and in-service standards, raising awareness campaigns that help our services be their best. As I mentioned earlier, this is our focus this year and next, embedding those valuable foundations. Toolkits on the horizon for us are things like new and expectant mothers and how to support our colleagues on those important life journeys. Let's talk menopause, supporting mental health, but it also, using toolkits, gives us the flexibility to navigate our organizational changes. So for example, with workload, it's an opportunity to say, right, this is something we need to focus on. Let's develop a toolkit with training for our managers to deliver and support. Our workplace wellbeing community of champions. This is something we are all very proud of. As well as the wealth of support I've just been speaking about with resource and our organization and our engagement with managers and directors, we are very lucky to have a strong community of mental health first aiders and wellbeing champions. And these colleagues are embedded within the services. They are knowledgeable, passionate, and make a real difference to people's lives when it really, really matters. And I have so many heartwarming stories to share about them. We continue to offer free mental health first aid training to all colleagues and awareness training, and hear how much of a value that is. Mental health first aiders, alongside our networks and our anchor groups, host many events and work hard to raise awareness for the challenges that our colleagues face. Enhancing our management training officer. This year, we will see the launch of the Be Your Best Health, Safety, Wellbeing Manager program. That's a really big step up for us, and it will not only raise awareness, it takes us back again to having managers who are competent and confident to make the right choices. And that approach weaves into all our health, safety and wellbeing topics, including violence and aggression, including mental health. When we've got managers who are confident to make these decisions and support colleagues, we know that we will have colleagues who have a positive experience here at Leeds City Council. Thank you, Rob. Mental health. Several of our mental health and wellbeing areas overlap naturally. However, again, we agreed to discuss them separately, and I believe that that's the right thing to do. And when I work within the council, I look at them in 2 separate areas so that they do have absolute clarity and focus. Joining up our internal mental health experts through a mental health action group. This is something that we've done since I was last here. This group is a cross-council representation. It's got really clear terms of reference. It meets regularly to connect, to collaborate, to sense check our direction of travel. Things that change quite often within the mental health space and the wellbeing space is the use of language. So it's important that we have expert colleagues working with us so that we can sense check that. The benefits include making the most of our in-house experts that help us drive local work that's purposeful and helpful and simple to get the right results. Refreshing our mental health toolkit. Again, we're looking at our stress management, our stress risk assessment and management of stress within the workplace. And we want to connect all the dots to create a toolkit that's easily accessible for managers. So that's in the development at the moment. It's currently going through trade union consultation. We want to really develop our community of mental health first aiders. Since October, we have hosted 2 mental health first aid connect sessions where our CEO reiterated his support to remove stigma around mental health and the priority mental health has within this organisation. Looking ahead, we aim to be better joined up with the activities and create a clear calendar of events across the authority. We want to bring our community together more, invest in them with time and knowledge and harvest their experiences to help us navigate improvement and increase their visibility within the services so everyone knows who to go to, who they can reach out to for help and who to go for support. To support them as natural trauma sponges with decompression sessions, we're looking into clinical supervision support from our public health colleagues. And obviously, we have the ongoing one-to-one free counselling available to all our mental health first aiders, which I remember was an issue we picked up last time. The last thing to update you on is preventing and supporting mental health related sickness absence. This is such a multifaceted and complex situation. It takes a lot of time and a lot of understanding to unpick. The key elements for me at the moment, there are 3. The first one is stress risk assessment and responding. We are currently working within services with high instances of mental health absence to look at the mental health, the stress risk assessment and mental health toolkit, individual and team, to pick up causational factors, implement solutions, provide better support. We hope to see less mental health related absence in the future, but when it does occur, we hope to respond and manage it appropriately. The second area for me is the combined efforts. When we look at those conversations at director level, we look at the business partnering, we look at those in-service health and safety wellbeing officers who are there with tailor-made solutions for managers to help coordinate this work. That along with the management standard, we're naturally going to drive up standards of support, prevention and promotion within those services. And then the last thing for me is helping managers to be their best. This is key for us. We want our managers and their teams to have safe and trusted relationships that create a really positive culture. And that minimizes the risk of work-related stress and conflict, and it reduces stress absence from work. Raising awareness amongst our managers, increasing knowledge and improving team culture encourages all those healthy conversations that will yield very positive outcomes for us in the long run. I know that's an awful lot to share with you. I've tried to go through really quite succinctly because it's an enormous area, but it is a very, very positive area for us at the moment. Thank you, Chair.
Thank you, Lisa, for the presentation. And before I open to the board members, the performance information we saw in the last item shows the average number of days off has increased. Do we think our efforts are working across all services?
Thank you, Chair. I think naturally there are services that are more mature and more focused, but in those areas where we need that extra support, we are ensuring that support is given and the focus is given. When we look at well-being in particular, or actually health and safety culture, things take a little bit of time. And what I'm very conscious of is not scattergunning. Let's be really focused on what we're trying to do, and we can't achieve everything all at once either. We've got to manage our expectations. This is a top priority for us, and the work that the business partnering team are doing now and the wellbeing team with the standard working with managers will yield positive outcomes for us.
Thank you. Any comments or questions from Councillor Hinchcliffe, please?
Thank you very much. And thank you for the report. This board last year, in my time here, took it very seriously. So we're very pleased to see you back. In the report, you went quite heavily on the mental health first aiders aspect. I just wondered if there's any gaps in this provision and whether, if there are, in certain services where we could look for mental health first aiders to work across different departments. Thanks.
Thank you, Councillor Hinchcliffe, and thank you for the positive feedback from October. It was a brilliant session and it really has helped steer us over the past few months. Mental health first aiders are an enormous community for us. They're very passionate. We do have a few gaps, but we are working on that at the moment. I think the important thing for us is getting overall coverage, so that we don't have lots and lots in one area, but also we need to understand that certain services require more because of the work that they do. So we have to make it quite academic. We're so privileged to have an in-house mental health first aid trainer who receives amazing feedback all the time. And I know the courses are very popular. We continue to run those. We have a full events calendar of them. We are at Extended BCLT this week with our leaders talking about mental health first aiders, and the ask of them is please go out, make them visible, let everyone know they're there, and make sure you've got enough of them because we are here waiting for you to train them.
Yeah. Thanks very much. Yeah, if we could get some statistical kind of breakdowns on attendances at sessions and things like that, and the gaps that you have mentioned in provision, that'd be really helpful next time. Thanks.
Thank you. Councillor Timmins.
Hi, thank you for the report that you sent out beforehand. As someone new to this organisation, it was really helpful to understand what we've been doing. Really positive, and it was great to see how passionately you delivered your presentation just then. So I've got a few threads of questions coming from what I've read. Some of it you've actually probably answered anyway in the presentation, but I'll crack on with the first part if I may. So from the performance report, we saw that mid-year appraisals were not carried out last year. I'm just wondering if I could get maybe some background around why they weren't done. The report mentions that health and wellbeing is a key part of the appraisal process. Do you think that these not being completed presented a missed opportunity in terms of workload pressures and addressing the health and wellbeing issues and ensuring managers are buying into the organisational values? And on that same thread, I can see that in adults and health, they have the one-to-one wellbeing conversations, which I think is really good. Does that occur in other departments? And if I could just ask, is there a plan to reintroduce the mid-year appraisals? And that's the first part. If you'd like to come back.
Mariana or Lisa, do you want to come in?
Yeah, thanks, Chair. Thank you for the question. Yeah, it's a really good one. To be honest, it's a complete balancing act. One of the reasons we didn't do the mid-year appraisals last year was because of workloads, and we were trying to remove a pressure instead of that relentless nagging that we do about the importance of appraisals and trying to steer those appraisal conversations. If you recall, well, you won't recall, but during COVID, we almost stripped back appraisals to only focus on wellbeing and really try and get those basic requirements in place so that we were really supporting staff. And then gradually since COVID, we've layered in other things back into them around performance and, you know, kind of objectives where how people are working, personal development, as I mentioned earlier. I mean, we'll never know whether it had a negative effect or not, but our judgment was that, you know, having that extra layer of requirement around mid-year appraisals probably wasn't the best use of time. But we are constantly encouraging in our comms, you know, to be checking in on wellbeing, making sure we're signposting people to things like Vival Power, you know, kind of provider around support, and that people are using peer-to-peer support, and although, you know, trade union staff networks, Freedom to Speak Up, Guardian. So yeah, I can't answer the question definitively, but our judgment was that it was better not to do the mid-year appraisals, but to still focus on those one-to-ones. We often have debates about whether we should have a one system of a one-to-one, and everybody should do the same length of time, same frequency, same format, etc. But as this board knows, our workforce is so complex and so diverse that doing that wouldn't make sense. There is good guidance on Insight about what a good one-to-one looks like, you know, what components it has. But the reason for me emphasising the focus on Be Your Best earlier is because we do want all managers to be able to be really good at managing their staff, so that all staff are really well supported. In terms of the question about rolling out the one-to-ones, I think they do happen in a lot of areas, but it probably wouldn't be right to just say everybody do that as a blanket, because it just wouldn't work in some areas. As to the question about reintroducing mid-year appraisals, probably, but we, you know, the cycle closes in September for the current end of year. So we'll kind of take stock as to where we're at in relation to financial challenge, workload pressures, staff feedback, to understand how, you know, what's the best judgment on that.
Okay, Lisa, do you want to come back?
Thank you, Chair. Just to reiterate, Mariana's covered everything, but just to say that in our Be Your Best organisational plan, well-being is one of our key expectations for managers. So it is very much woven into those one-to-ones.
Thank you. Councillor Timmins, do you want to come back?
Yeah, so the next little thread actually follows on from that. So I'd like to just move on to management development, if I may. In terms of the pulse and staff engagement surveys, you provide us with the results for each department, but as an organisation, do we drill down even further into each department to identify opportunities in specific sub-departments that may impact the overall results? And if so, what do we do to address these when we identify them? I think it's really positive that we're training on the Be Your Best health and safety and wellbeing. That really stood out. Having the confidence as a manager and the tools to work on this is really important. But on that same side, having an effective manager can have an impact on so many people that work under them. So I would like to know what we have in addition to this to help managers manage their own workloads, build relationships with the teams, help them make confident decisions within their role. And particularly we've got new people in roles. What are we doing them to support them and making sure that they can impact this straight away?
Thank you. Mariana, do you want to pick up?
Yep, sure. So the first one around kind of pulse and staff engagement and drilling down, the former board did do have a session on it, because we did produce a dashboard that does drill down as far as you can go without compromising anonymity. And so each manager got that access to that dashboard and could have a look in, and everybody could have a look at everybody else's as well. So if I give you a practical example, you know, some of our workforce in civic enterprise Leeds is more similar to some of our workforce in, you know, housing or waste than it is, for example, to other parts of my directorate. So what we were encouraging was managers who had similar workforces to collaborate and benchmark and share with each other, rather than necessarily to compare with people where actually the workforces are very, very different. So we did do quite a lot on that. And I know certainly with colleagues from HR have just been going around each directorate leadership team recently saying, where have you got to on that? What else has happened? And so there has been a lot of activity. I don't know whether it's something the board would want to return to, you know, for a substantive update, maybe later on in the year or not. But for the moment, I can reassure you that, yes, it did drill down. Yes, there was encouragement to kind of look across. And also, you know, for that to be, again, a bit like Lisa's just said about wellbeing, looking at staff survey results is something we nag about relentlessly in the comms that we do to managers and to staff as well. And in terms of the Be Your Best training, again, I don't know whether it's worth us bringing a report back. Kind of, my colleagues are going to be shooting me for all this, the work I'm going to be asking them to do, but about the Be Your Best offer, because there is a really extensive training officer, particularly for new managers, but also for experienced managers. Obviously, our focus in the last 12 months, as colleagues who are on the former board know, was particularly around EDI. And the focus this year is particularly around health and safety and wellbeing. But we can, you know, there is all sorts of other things in there, like relationship building, managing projects, you know, managing workload pressures, etc. But there is also a challenge in terms of people having time to go on them. So do you know what I mean? This isn't a simple one at all. But yeah, there's a very extensive Be Your Best offer that, again, maybe we could bring back a future item on if the board would like that.
Thank you, Mariana. Lisa, no? Okay, I've got quite a few members patiently waiting. Next one is Councillor Hamilton. Okay, Councillor Renshaw then.
Thank you, Chair. No, mine's regarding comparisons with year-on-year results, because I know there's been huge increase in stress, pressure, and the workload year on year, and I'm just wondering how you really manage that because some people will not admit that they feel under stress, or that they feel it makes them feel incompetent, as if they can't do the job, when really could allude to a mental health issue. So I'm just wondering how you identify that and how you get them to have the confidence to come and say something in the first place. And also, have you compared with neighbouring authorities of what their results are and what the levels are in Leeds? Because that would be helpful. But I think to compare back with last year or the last couple of years with this year, just to see how effective the work that is being done is actually being impacted by the workforce. Thank you.
Thank you, Councillor Renshaw. Lisa, then if Mariana wants to comment, she can as well.
Thank you very much. They're really, really good questions. The first one I think that's important to address is colleagues feeling safe in a working environment, in particular when we look at all the personal challenges our colleagues have at the moment. Working in an environment where you have a good relationship with your manager and your team, to feel safe to say, I'm struggling, to have that conversation whereby you feel safe to say, can we just have a chat about my workload and the topics that, you know, the work streams I'm working on. Feeling confident to ask for help, to reach out, is something that when I speak to colleagues out in services, we are getting much, much better at. I think the stigma associated with stress or feeling vulnerable and mental health and well-being is disappearing. Colleagues are talking about it. In Leeds City Council, we feel, we hear and we see this narrative. It's in most of our conversations. So I definitely feel that our culture of support is there and it is improving all the time. With regards collaborating with other councils, we do that, and that again is a relationship and a partnership that's growing. In particular at the moment within our occupational health space, we've made some really good relationships and join-ups with local councils on the work that they're doing around mental health and stress and workloads. They will grow and develop, but I'm looking forward to learning a lot in that space, and I'm sharing best practice on both parts. Data. This is something, again, we're fledgling, especially with the mental health, with the wellbeing standard. As we get this data in, our business partnering within HR, occupational health, health, safety, wellbeing are very targeted. We have service level profiles which break down our risk and our support and prevention, and that enables them to set a tone. In health and safety terms, your auditing program tends to run from January through to March, so you get that rich data ready to set your stall out for the next year. So we'll capture that, and maybe it's a good opportunity for me to come back then at that time of year and share with you the work that we've done, in particular around the implementation of the standards, so that you can see that being rolled out. Is that helpful?
Thank you, Lisa. Anybody else? Any got question or comment? No. Lisa, do we have a figure for how much staff absent costs the authority, please?
It's working now. Thank you. I'm going to go back and double check it. I do have a figure, but I'm not 100% confident that it's right. So if you bear with me, let me go back, have a look at it, and then I'll share it.
Thank you for the presentation and responding to the board member as well. And are we happy to approve the recommendation on page 79? Yes, thank you. That brings us to the end of today's meeting. And at the beginning of the meeting, I forgot to mention, and I'd like to wish those people who have been celebrating, the Eid festival over the weekend, and wish them Eid Mubarak. And thank you for your attendance and for your contribution today. Our next meeting is scheduled for the 22nd of July at 10:30 a.m. But as usual, our pre-meeting is going to start at 10 o'clock. The board members are welcome to